Premier, how close are we to extending this lockdown?
Well, obviously, the numbers aren't going in the right direction. That's pretty obvious to everybody. And the number that concerns us the most is the number who've been exposed in the community. So last night we saw 33 people who were diagnosed who had some level of exposure in the community. And that is the number that we need to see go down to as close to zero as possible. We appreciate that those already in isolation who subsequently develop the disease, that's always unfortunate. But in terms of the greater public issue and challenge we have, it's really getting down to as close to zero as possible, those people who have been exposed in the community, because that tells us there could still be unknown chains of transmission. And the whole purpose of the lockdown is to stop people moving and to stop those chains of transmission. There are some that are already there, and our health contact tracers are doing a great job of identifying those. But that's why we need everybody to stay at home. If everybody stays put, that means the disease doesn't move further into the community, and that's what we need to prevent through this lockdown.
So we're basically in lockdown indefinitely now until we get that number down, the number of people infected in the community. We're not coming out of this on Friday, are we?
Well, we always have to assess the health advice, but I think it's pretty plain to see that the numbers are not going in the right direction at this point in time, and I want the community to be prepared for that. I've foreshadowed that for a few days. As soon as we have health advice that gives us information on where the numbers are tracking and what we think the future looks like, we'll of course convey that. We always do that. As soon as we know or have a sense of where the data is going, we of course let the community know. But obviously at this point in time, the contact tracers have uncovered a number of chains of transmission, and were it not for the lockdown, it would have been really hard to identify those. But because we know that people are moving in certain communities in a particular way, our contact tracers have been able to stay a step ahead. And that is the whole point of the lockdown.
This lockdown is scheduled to end on Friday. Businesses need a plan. So is your plan to extend the lockdown week by week, or will you come up with, I suppose, a long-term plan to give residents and business owners some certainty?
No, look, that's a great question, and we always want to provide enormous certainty to our community, not just businesses, but for parents, for any individual to be able to plan ahead, and we certainly will provide that advice as soon as we receive it. But I also do want to stress that the length of time of the lockdown is dependent on all of us. If people don't leave home unless they absolutely have to, we'll come out of this sooner rather than later. But that's why I want to leave the door open to the advice we provide. It really depends on how quickly we can turn the numbers around. But given where we're at, and given the lockdown was supposed to be lifted on Friday, I think everybody can tell that it's highly unlikely at this stage, given where the numbers are. And we've always been very upfront about that. I've always said that we need that exposure number in the community, those 33 that we had last night, to be as close to zero as possible, so we're confident that we haven't missed any chains of transmission. And I want to say that even though the focus of new cases is emerging in southwestern Sydney, please know that many people are interacting across the Greater Sydney area through essential things, through essential needs. So don't assume because your suburb isn't listed on concerned venues or cases that you are somehow immune from this. This can affect anybody, anywhere. And please be aware of that. Don't think that because you live outside a particular community. I mean, we've had cases now crop up in certain parts of Greater Sydney because essential workers are moving around. People are moving around on multiple sites, are unfortunately spreading the disease. And we've seen that in areas outside of southwestern Sydney. So this is a situation, a challenge for all of Greater Metropolitan Sydney, including the Central Coast and Shellharbour and Wollongong. Just because you haven't had a case now doesn't mean you won't. And we'd much rather ensure that we prevent that community spread than have other communities go through these number of cases.